Differences in patient emergency department experiences, comparing Press Ganey versus on-site surveys at emergency department discharge. A paper by Drs. Roa, Papa, Kennedy, and Motti, presented by Dr. Tucker Motti. Our group has no disclosures. The impetus for this study was the perceived disconnect between emergency department rendered patient care and the Press Ganey score. The graphic pictured is a great representation that confirms our hypothesis in this study. The current system of emergency department evaluation relies on a survey that is collected long after the visit is passed. Studies demonstrate that currently HCAHPS has an average response rate of 32%, and AEM 2018 quoted an ER survey response rate ranging from 3.6 to 16%. In the researchers' literature review, we did not find any studies that directly compared the accuracy of parallel Press Ganey and in-person surveys. This prospective cross-sectional study enrolled a convenience sample of adult patients being discharged from the ED of a tertiary care center over 2 months. Patients being discharged were provided an anonymous hard copy of a 36-question survey identical to Press Ganey's and were allowed to complete it independently. Our facility is a tertiary academic facility with a Level 1 trauma center and greater than 100,000 visits per year. Inclusion criteria for the survey were patients that were English speaking, age greater than 18, and were being discharged to the community. Exclusion criteria were patients in the emergency department for a primary psychiatric or neurocognitive diagnosis, incarcerated patients, patients that had completed the survey in the last 90 days, or patients that were being discharged to hospice, rehab, and/or an adult living facility. Seen below are some of the categories that patients evaluated the emergency department in their survey. Pictured below is a snapshot of an excerpt from the survey that the patients were given in person. This was identical to the Press Ganey survey that would be sent to them later on. The objective of this study was to identify if patient satisfaction scores collected on-site and at discharge were significantly different from those collected by Press Ganey over the same time period. Going through the results of this study, there was a significant difference between on-site survey results and the Press Ganey survey. In dark red, you can see the on-site results for overall rating of care, likelihood of recommendation, courtesy of the doctor, doctor concern for comfort, and being kept informed about your treatment. As shown, these were all well above 80%, while the Press Ganey results ranged about 20% points lower. Continuing in our discussion about the results, this time with the on-site survey results in red on the right, we see the comparison of courtesy of the doctor. A stark difference, showing that the on-site survey shows a very good of 86.7% compared to the very good percentage of the Press Ganey at 66%. All studies have limitations, and the limitations that our study experienced are pictured above. Patients left out of the on-site survey also included those who eloped or left unexpectedly prior to survey completion. In conclusion, most visits to the ER are not planned. The resulting financial impact and potentially difficult recovery from illness is often reflected in a survey. Our study highlights the important differences between on-site and off-site, also known as Press Ganey, surveys. The larger sample size afforded to the on-site survey can help identify areas for potential improvement rather than the approach of chasing outliers. Press Ganey has its limitations, but this study was not designed to eliminate the role of Press Ganey, because whether you like it or not, it's here to stay. Its widespread adoption and its usefulness in comparing local competition drive its continued presence in our world. Thank you so much for this opportunity to present in SAEM 2020.